afternoon again. I'm Gray Ficker, and I'm with the Superior Health Quality Alliance or Association for Chronic Disease Management team. Welcome to our third webinar in the Back to Basic and Beyond, Baseline and Beyond webinar series here. Today's webinar is on community approaches in hypertension control. And this webinar series, Back to Baseline and Beyond Post-COVID Management of Patients with Chronic Conditions, is focused on helping care providers across the continuum of care use lessons learned from the pandemic to improve chronic disease management and outcomes. So please take a minute to enter your organization name, facility, and your role in the chat so everyone can know who you are and get credit for joining us today. A few housekeeping notes. We'll have time at the end of the session for questions and discussion. So please feel free to add your questions to the chat. During the presentation, we'll make sure they get answered or follow up as appropriate with time. Okay. Here's our objectives today. So during this session, the participants will be able to learn about the latest guidelines, research, tools, and resources physicians and healthcare teams can use to help patients reach and sustain healthy blood pressure levels. We'll be able to gain awareness of and the ability to share blood pressure prevention and management resources with our patients and families, and discover outreach strategies for rural areas to share hypertension control methods for healthcare providers, patients, and our community partners. And let's get to know our team here. So we are joined by a panel of speakers for the American Heart Association. As you can see on the left, I'll just go left and right. Tim Nicolai is the Midwestern Senior Rural Health Director, and Obi Nwazabuzor is the Community Impact Director for Wisconsin. And I apologize, I think I added an extra syllable to that one. And then Rebecca Ostosh is the Community Impact Director for Michigan. And Suling Chardon is the Community Impact Director for Minnesota. Well, welcome and thank you for joining us, all of our panelists here. And here's a little bit about each of them, and I'll turn it over to Suling to get us started.
Thank you, Gray. Thank you for having us. What you see here is our core priorities. The American Heart Association sets a impact goal periodically, and so our latest is a 2024 impact goal, and that is every person deserves the opportunity for a full, healthy life. As champions for health equity, by 2024, the American Heart Association will advance cardiovascular health for all, including identifying and removing barriers to healthcare access and quality. To reach this goal, the American Heart Association has identified some core priorities, with equity always at the center of our work, guiding all that we do. And you could see here, those core priorities are blood pressure, nutrition security, community response, tobacco vaping, and health equity, which is woven into all of those. Next slide. First, we're going to talk about blood pressure. Now, on the clinical side, the American Heart Association works with clinics and health systems on various evidence-based strategies around our core priorities that I just went over. However, the bulk of our clinical strategies does fall under the blood pressure core priority. We work with both health systems and community clinics, but since our clinical work focuses on populations with the greatest need, most of our time is spent working with federally qualified health centers and other community clinics such as lookalikes or free clinics. We also have a community-based strategy, and that is a screening and referral strategy. And we'll go into more detail about the implementation of these. But first, I wanted to share a little bit about our ambulatory programs. Next slide. So the American Heart Association has 3 ambulatory quality improvement initiatives that's designed to help you improve outpatient care and outcomes. Our initiatives work together to reduce cardiovascular deaths, heart attacks, and strokes among the 100+ million Americans living with hypertension, hypercholesterolemia, and/or type 2 diabetes. The Target BP program that's listed at the top is in partnership with the American Medical Association, and the Target type 2 diabetes initiative falls under a larger initiative called No Diabetes by Heart. And that initiative is in partnership with the American Diabetes Association. These three initiatives, I like to think, are divided into three main areas. There's provider resources, patient resources, and a national recognition component. So under the provider resources, those resources are designed to help healthcare providers apply the most up-to-date evidence-based treatment guidelines to improve patient outcomes. There's various management guides. There's webinars with CME credits. We often have a number, probably a few live webinars every year. However, a lot of them are made evergreen, so you can find these recorded webinars on the sites listed below, and you can also find them on our professional education page, which we'll go over later in the webinar. And you can still receive continuing education credits. Most of them are no cost. There's one in the Target BP e-learning module where there's a small fee, but for the most part, they're all no cost. There's also podcast series that you can find, especially with the cholesterol and diabetes programs, if you're interested in that. For the patient resources, there's linked on the web link, fact sheets, infographics. The No Diabetes by Heart website has both a consumer-facing and a professional-facing page. So you can access the professional page and refer to your patients to the consumer-facing page. The recognition component, each of those initiatives have an annual recognition opportunity. There is a data submission component to it. If you're familiar with it and you thought it was burdensome, a lot of the data points has been significantly reduced, so it should be much easier to participate in. And there are both national and local recognition opportunities. On the national level, you'll be posted on our website, featured at one of our annual meetings, and posted in a national print opportunity. And we also encourage organizations that are doing well to share how they're doing well and what they're doing so that others can learn from you. So that's an opportunity as well for sites that are doing that have great control rates. And I'll mention too that the blood pressure and cholesterol, those are focused on improving control rates, and the diabetes program is focused on raising awareness, increasing that awareness of for people that have type 2 diabetes, that they are at risk for cardiovascular disease. And if you want to learn any more about these programs, feel free to browse these websites that are linked to slides, or you can set up a meeting with any of the AHA staff on this panel today, and we'd be more than happy to walk you through all these initiatives. Next, I'm going to turn this over to the Wisconsin team.
Yeah, definitely. So there's a lot of work that we're doing across the state around self-measured blood pressure programs, or we also like to call it self-monitoring blood pressure programs with patient care. Nationally, only about 10% of clinical blood pressure readings meet our actual guidelines identified by the AHA from a national level based off of our research. And a lot of evidence shows that if self-monitoring blood pressure or self-measured blood pressure programs are implemented and very effective, it helps patients better manage. I think you guys missed me here. It allows for the outreach done through that patient engagement to better maximize the benefits that patients have with their primary healthcare provider. A lot of the work that we've done in this area focuses on accurate measurement to include addressing one's diet, lifestyle factors such as healthy eating, healthy activity, exercising, etc., blood pressure awareness, and maximizing the benefit of what it looks like to really manage one's stress and their mental health. Patients who have access to validated blood pressure monitors are supported by a standard training protocol, and that's also additionally for staff, along with a mechanism for home readings so that we can assure that patients are reporting back to their primary healthcare provider. We understand that in the pandemics, even more so, a lot of patients weren't even seeing their primary healthcare physician even once a year. And we know that even before the pandemic, that some patients are even only seeing their primary healthcare provider once a year. So assuring that we have that patient physician care coordination with the teams internally is very important. And we've noticed that self-measured blood pressure programs help advocate for that and advance that work. In some of the clinics that we've been able to work with in the state, Hope Clinic and Outreach Community Health Center is where some of this examples of work comes from.
Thanks, Obi. And if you can go to the next slide, Gray. So good afternoon, everybody. I'm Tim Nicolai. I'm the Senior Rural Health Director for the American Heart Association, but was focused exclusively in Wisconsin until very recently, where I had a chance to work with the Racine Public Library. And it was really an opportunity to take our blood pressure work outside of a clinical setting wholly and move it to a community location. So the library in the fall of 2021 hired a social worker as a full-time staff person. And connect with them about what could we do in conjunction with the library to improve the health of their patrons and their community as a whole. And so we took validated blood pressure monitors that are validated for clinical accuracy and made them available for patrons, both in the library at kind of a kiosk setup and for checkout. And AHA helped coordinate some good educational materials and resources on what is high blood pressure, why should I care about it, how do I use this monitor, that type of information, and made it available in conjunction with that monitoring. We also, in the library was a big part of this, reached out to a couple of the local schools of nursing. And starting in the fall semester, students will be coming in monthly to provide validated blood pressure screenings and basic lifestyle modification information for the patrons at the library. What was important to us too, though, is that we don't just capture this data and leave it in a vacuum, particularly if there's a real health risk that's potentially identified. And so for those with high blood pressure and no medical home or who may be struggling to access care, they will be referred to one of the free clinics in the area. One of the ones actually that we worked with on a self-measured blood pressure program. And whether they may end up enrolling in that SMBP effort, or they may just receive alternative care and guidance from the healthcare professionals at that organization. We also know, and this is a good lead into what Rebecca is going to share about, that hypertension does not exist in a vacuum, and that individuals sometimes struggle with their blood pressure because they don't have great access to healthy, nutritious food. And so we supported the library in connecting to Feeding America and the local UW Extension folks to start screening for nutrition insecurity using the hunger vital sign screenings, and then connecting those individuals to existing resources in the community. And so really what we saw all of this coming together is that when a patron walks into the library, there's all manner of things that the library is helping them to address and meet their needs. But we were happy to be able to add a couple of pieces to that and really start a conversation around health in a couple of different ways with the library and their patrons. And we're excited to see that impact continue. And with that, I'll turn it over to Rebecca.
Thank you, Tim. Again, my name is Rebecca Astash, or Beck, and I'm the Community Impact Director here in Michigan, physically located in Grand Rapids and serving the whole state. And so, yes, I'd love to take the opportunity to dig a little bit deeper into some of our nutrition security work, what those opportunities are, what are those systems that we're looking to influence and change, and also just provide a quick case study for what we've done here in Michigan. So next, Gray, if you could go to the next slide. Thank you. Again, so for nutrition security, we're really looking to implement food security screenings in the community and provide referrals in non-healthcare centers. It really is more like a revolving door where some of the programs that we have worked on are providing referrals from within a food co-op or a food pantry or community center back to FQHCs or local clinical partners, and then also really working on identifying patients within the clinical setting and referring those who are nutrition insecure out to food sources within the community. And so in the case of Grand Rapids, specifically here in Michigan, we did work with a local food co-op and a local FQHC to really identify patients through the Target BP program to recognize and to identify a group of hypertensive patients who were food insecure. And what we did with them was we were able to, again, partner them with food vouchers so that they would have a month access to fresh, healthy food, a source that perhaps they didn't know was available prior to the voucher, to also be providing them with resources that they need in food boxes, including a blood pressure monitor from our validated device list, and equipping them with educational resources on healthy recipes and different ideas of what they can do with the fresh fruits and vegetables that are found in the food box that is provided. As I mentioned too, I think we can get really creative in this space, and this is one of the reasons why we want to share some of these opportunities as Tim was referring to previously. There's so many opportunities to work in libraries, to create referrals within libraries, within barber shops. We've done in some regions as well, in some states as well, and doing blood pressure screenings and doing referrals for those additional needs. And this work can also happen in community centers, et cetera, depending on each state and the dynamics of the local community. So next slide, please. Another area that I will touch on and with some of the work that we've done here in Michigan is in regards to community response. You can go to the next slide, please. This is a really exciting opportunity for addressing the cardiovascular health disparities that we see in the community. So this is around CPR. What we've done, or what we seek to do through this systems change, is really eliminate the disparities to calling 911, the rates of response, the bystander CPR through, again, sustainable systems change. And so we've had some really exciting opportunities here lately, as well as in other markets, I will say, to partner with faith-based organizations or just community-based organizations in areas of high cardiovascular disease and low rates of survival, to really partner with them to create and adopt cardiac emergency response plans. And so these plans are really policies that contain the communications, different protocols, in the event of a cardiovascular emergency, how to work with their local emergency services as well, to introduce them to their plan and to socialize their plan as well in case of an emergency. We also partner with them as part of this plan to really develop their own cardio emergency response team. It's completely community driven. And we've been able to have even more impact through some local grants, although again, in some cases, we don't have those grants, and it's completely, we're still able to have a lot of impact, but with grants, a lot of times we're able to really supplement these programs by providing these local organizations with AEDs, additionally with CPR kits for training, and ongoing technical assistance. And so again, we found that this has been a very impactful program. And if this resonates with other clinics or community partners on the call, or ones that you're familiar with, we'd love to further strategize and how we can have more impact in this area. Thank you. Next slide.
Great. Switching on over to tobacco and vaping. Next slide. So, as I mentioned, we have clinical strategies in each of our core areas, and the one clinical strategy under tobacco and vaping is initiating healthcare provider reminder systems for tobacco and nicotine cessation. On the community side, we work with school districts on updating their tobacco and vaping policies. So it would be updating their existing wellness policies to include model language around this. Same with the workplace and organizational sites adopting model smoke-free policies. We have a list of recommendations and encourage sites to adopt those. On the local policy side, and the example here is restricting, eliminating the sale of flavored tobacco products, including menthol and electronic cigarettes. We work with our staff, we work with local municipalities. We also have staff that work on statewide advocacy as well as federal advocacy. So next slide. I'm gonna give an example in Minnesota. Oftentimes in Minnesota, we work on local policy to build the groundwork for statewide policy passing. This is how the Clean Indoor Air Act and Tobacco 21 policies all started, by passing local ordinances to build momentum toward passing a statewide policy. So I'm giving the example of Wilmington. I actually live in Wilmington. Last year, City Council passed an ordinance to end the sale of all flavored tobacco products, including menthol. The ordinance also provides for the official sunsetting of all tobacco licenses in the city through attrition. The city's no longer going to issue any new tobacco licenses. So if a store's license or a store closes, that license will be eliminated. They will not be offering a new one. And this went into effect last month. We're currently working with the city of Richfield to implement similar policy. And the way that we do that, there's a couple of sites I listed here. The Year the Cure Network is the American Heart Association's grassroots network that advocates for heart healthy and stroke smart communities through legislative and regulatory policies in our cities, states, as well as nationally. We provide tools to our advocates that you need to play a crucial role in the fight against heart disease and stroke. We help connect our advocates to key legislators, connect our advocates to other advocates close to them. And we also provide communications on issues that matter to you. So when you sign up, you can identify what areas of interest you have, and we would tailor our communications to that. And then we also work with a coalition called the Minnesotans for Smoke-Free Generation. And it's a coalition of Minnesota organizations that share a common goal of saving Minnesota youth from a lifetime of addiction to tobacco. So there's a lot of nonprofits on there. There's health systems, there's local public health, there's some individuals, local medical societies. So if that's something of interest, do take a look at those two resources. Okay, next, we're gonna switch it up and turn it over to Tim to talk about rural health.
Yeah, thanks, Su-Ling. So I am the new Senior Rural Health Director for the American Heart Association in the Midwest region, which is a 13-state region from the Dakotas over to Michigan and Ohio and down to Kentucky and Missouri. And in many ways, my work is designed to help bring the strategies you just heard about to the more rural parts of our region. If you can go to the next slide, Gray. So in February of 2020, we released our Presidential Advisory on Rural Health, which was really designed to be a call to action as we compiled evidence about the disparities facing rural communities and looked to try to strategize around solutions for that. Unfortunately, that came out just before COVID arrived. And so a lot of things got set aside kind of, and it's just now that we have a real opportunity to try to operationalize some of the recommendations in this presidential advisory. If you go to the next slide, please. So one of the questions that always arises when we're talking about rural health is, what does that look like? It's definitely a challenge that has faced more organizations than the American Heart Association. There is no single accepted definition. OMB has one definition, others are using census tracts rather than counties. Generally speaking, we've settled on prioritizing counties with less than 50,000 people as their population, which is a significant number of counties and a significant land mass across Minnesota, Wisconsin, and Michigan. And we've really found this HRSA tool, the Am I Rural tool, to be very helpful in evaluating the rural status of a particular organization or community. So, if anyone else is interested in doing work in rural communities, I would encourage looking that up. You can put in an address, a zip code, a county, or a city, and it'll tell you the classification of that location. On the next slide, you'll see some of the disparities facing rural communities. And many of them align with the topics we've already talked about. Rural residents face a higher rate of uncontrolled high blood pressure. They have generally higher usage rates for tobacco. The distance and other factors make it harder for them to access good nutrition. And again, distance and the location of EMS agencies and access to healthcare can make the immediate response of the community in terms of CPR and cardiac arrest even more vital. Unfortunately, the life expectancy gap between rural and urban areas has reached about 3 years. And seemingly over the last couple of years, that gap has grown again, largely as it relates to the opioid epidemic and some of the disparities around COVID-19 death rates. Rural communities were generally slower to have the epidemic hit them, but the consequences were more severe in the end, partially because of, again, that access to care questions that emerge. And so my role, again, is to, how do we work with organizations and community stakeholders in these communities? And those can take any number of shapes and sizes, to drive sustainable, or as we call them, policy and systems changes that can help benefit the health in those communities and eliminate or reduce anyway some of those disparities. On the next slide is one of the opportunities we're looking at to help us do just that. We were fortunate enough to receive almost a $9 million grant from Public Health AmeriCorps. And we're looking to add to that. We just recently got $3 million to support HeartCore in a few states, including Minnesota. But the overall purpose of kind of this combined funding is to expand the health impact in rural America. And so we're going to be placing 14 of these HeartCore service members across 7 of the Midwest states, including Minnesota and Wisconsin. And that's the lineup for year 1. Hopefully year 2 will allow us to expand into Michigan and other locations as well. But again, the focus is on changing policy and practices and working with the service members and their host organizations to identify what are the needs facing the community in some of these areas, and what is a process that can be established that will help address that, not just for the 10 months that the service member is there, but hopefully well into the future. So the primary focus of these participants is to be on blood pressure. Things like a lot of what Obi talked about, accurate blood pressure measurement for staff and within a facility, self-measured blood pressure programs. It could be along the lines of the library program I've referenced as we try to foster community and clinical connections, especially, like I said, around blood pressure and nutrition. But there will also be some opportunities, depending on the needs of the community, to talk about tobacco use and look at what it would look like to support the local school district in adopting a more comprehensive tobacco-free school policy. I was fortunate enough recently to work with the Ithaca School District, which has about 500 students in rural Wisconsin, to help them adopt a comprehensive tobacco-free schools policy and adopt a more supportive approach to discipline when students are struggling with an addiction. And so for those of you in Wisconsin and Minnesota in particular, I would invite you to consider being a host site for AmeriCorps for this HeartCore project. There's a survey on there, and I'll try to get it in the chat here in a second as well. Just a few brief questions about who you are and what kind of things you're focusing on. And if you are interested and fill that out, then we can have a further conversation about what that could look like. We're excited to see a number of good projects move forward, certainly. I think that might have been my last slide. Perfect. So I'll turn it back to Sue Ling for some AHA resources.
Thanks, Tim. I'm going to be sharing. Oh, Greg, can you give me access so I can share my screen? Going to be navigating the website.
I just made you a co-host, Sue Ling, so you should be able to share.
Thank you.
Yeah, Jerry's actually been the one facilitating.
Oh, okay. Let's see. All right, hopefully you see a website. Okay, awesome. Now I have these links to the slides that I'm gonna go over, but I thought it might be helpful to navigate our website. So the first page that I have it on is our Professional Heart Daily. And if you just go to our website, www.heart.org, there should be like where this menu is, there should be one that says Professional. If you click on Professional, you can get to the Professional Heart Daily. And this is where you could see some recent and current science news. It talks about some professional education events, some current journal articles, and it might have some, it has information about becoming a professional member of our organization. Okay, so just in a nutshell on that page. I also wanted to show this communities tab. Since we're focused on hypertension, you'll see on here when you click on it, there is a hypertension and nephrology community. And if we click on it, it's gonna tailor it to that topic area. So the news on here will be related to hypertension and nephrology. It'll link to the journals, continuing education. Hypertension scientific sessions is their specific professional event around hypertension, the different scientific councils as it relates to hypertension. And then right next to the communities, you'll see the guidelines and statements. So if you click on that, you can go straight to searching for guidelines and statements. So, you know, for example, if you're looking for the most current hypertension guidelines, treatment guidelines, you could click on that. If you're looking specifically for pediatric hypertension guidelines, you can search for that right there. And then there's various links to some risk calculators, pocket guidelines, endorsements by the AHA policy. So if you're looking for anything around guidelines and statements, you could find that there. We also have linked up here a link to our journals, and I'll just click on that really quick. He has some featured articles, but it'll list all the different journals of the American Heart Association right here that you can explore as well. Let's see, and then continuing education. We have that here, this link here. And I also have it on this page here, so I'm just going to go directly to that. And this is linked, or this is on, the link is on the slide that you'll see after I'm done navigating here, but you could search our learning catalog here, and you could filter what you're looking for. I know there's hypertension here. Let's see if it'll link. I know it did not link earlier at the earlier webinar. Oh, here we go. So it'll list the different webinars available that you could take, and you see like these are all at no cost, except for that one. Yeah, so there's lots of opportunities here. You can even search by credit type. So if you wanted to look for nursing, dietetics, emergency medicine professionals. So the AHA is an accredited provider for many professions. So you could definitely search by that as well. You'll also find any live events that we have, face-to-face events on here as well. Next, I wanted to share, we have an interactive cardiovascular media library. And this is also linked on the slides that you'll get. But you can look, here's blood pressure test. There's one on high blood pressure on the cardiovascular system. You could just click on it and you'll have, so it's interactive. So if you weren't familiar with that, that's available. Then I also wanted to show, so we have a page linked here on our website specific to high blood pressure. And this one, I feel like you have to do a bit of navigation. It lists some resources here, like here's a video that you could share with patients on how to use your blood pressure monitor correctly. There's information here about health insurance marketplace. But if you click on get the facts about blood pressure here, it will take you to another page that has another menu of options on the side here. And you can click on find high blood pressure tools and resources. And I'll link to some resources here. The blood pressure fact sheets. Now these are for consumers and patients. I like these because they're very simple, 2-pagers. And if you scroll down, there's specific resources for healthcare professionals. And that links to that media library here. And then if you click on the toolkit, on here it'll list some other patient-specific resources. Like here's a fact sheet about blood pressure raisers. Here's some resources for additional resources for professionals. There's a hypertension guideline toolkit for healthcare providers and for pharmacists. A link to our blood pressure treatment algorithm, how to measure blood pressure accurately. And then you'll also see here some resources in Spanish. Now, and then of course the Target BP, our ambulatory program, you're going to find a ton of professional resources there. Now on the patient resource side, now the blood pressure fact sheets that were linked on the blood pressure page, these answers by heart fact sheets, this is where you're going to find all of our fact sheets. And I like these because they're simple, like I mentioned, and they're written at a lower literacy level. And you can look up it by cardiovascular conditions, treatment and tests, and lifestyle and risk reduction. So I'll just click on these really quick. We have some pretty specific ones here. Lifestyle and risk reduction. We're going to find all the risk factors. And then these, a lot of these are available in Spanish as well. You can see the link here. We also have specific ones on stroke. That's called Let's Talk About Stroke. And that is linked on the main page of this one as well. Next, I'm going to go to our Healthy for Good page. And this one, you could scroll down. I like to share this one because there's a lot of, there's a link for recipes here. So if you click on the recipes, so if you're working with your patients and you're looking for heart healthy recipes, and you want to give them some ideas, you can go to this link. What I like about it is, you know, you could search specific ingredients. So let's say you want to find some heart healthy pumpkin recipes. You could type in pumpkin there and it'll list a bunch of pumpkin recipes. Or you could search by courses, whether it's entree, salad, or desserts. So that's there. And then also on that Healthy for Good page, I like to share the infographics that are available on here. So there's one about general wellness, physical activity. There's a ton on nutrition and healthy eating. And then you'll see a link here. There's a lot of these are available in Spanish as well. Okay, then I also have linked on here, since we're talking about blood pressure, this Release the Pressure website. Now this one is targeting African-American women. And there's videos here and then about the issue. So that's something that you could check out as well. Another, thought I had it linked here, but maybe I didn't. We also have a support network. And let me see if I could pull it up. I think I had difficulty last time too, but it's an online support network and you could direct patients who are interested in connecting with others there. And they can, there's resources by specific conditions, specific topics, and just a place for them, as well as resources. I think there's also opportunities to connect with a health professional and ask questions. Sorry, I think I might have the wrong URL with that one. Okay. Now I am going to stop sharing. And if there are any questions, and I think we can move on to the discussion questions.
So let's have a discussion here. The first question is, which of these strategies do you think would be of most interest to your organization or community? Or both? Feel free to enter in your answers in the chat or unmute and ask a question to the group directly, whatever works.
I was gonna say, I'd be interested to know too, if anybody has actually maybe used some of these strategies or resources. It'd be nice to hear about it.
I can start to get the ball rolling if that helps. Okay, yeah. So my work, I've worked mostly with Medicaid patients in the past and Spanish-speaking undocumented populations. So we have found those videos online, especially the ones in Spanish, to be super helpful, especially when it's been during the pandemic and you can't always ask, like, you know, describe to people exactly what to do, especially if it's just over the phone or if it's a digital visit. It's so much easier to have them get a reminder. I know one patient told me, a diabetes patient, for example, told me that even though it's not heart related, he would watch the video on how to inject himself, and then heart related, he would watch the one on how to do the heart monitor every time, just to get him in that mindset, and also just sort of a ritual. And I thought that was a really great idea, and especially for families, because that's a huge thing in a lot of healthcare. Okay, so does anyone else want to comment too? And thanks, Tim, for all those links as well.
Are there any resources that we didn't talk about that you have in mind that would be useful to you?
Great question too. Okay. So yeah, like I said, if you don't feel comfortable sharing directly, you can always add it to the chat. I'm gonna move on to the next question now. So how can you incorporate some of the strategies you learned about today?
One of the things I would share, and I think Rebecca kind of alluded to this a little bit earlier, is that these strategies have a degree of universality to them. And, I talked about a library, and Rebecca talked about some faith communities. And the noon webinar, we had somebody ask about grocery stores. I think the setting for a lot of this work can vary greatly from community to community. And I see a note about meeting the community where they are. So definitely would encourage you guys to go ahead and be creative. And, partners like AHA and Superior Health Quality Alliance, we can help figure out the details and bring the science to bear. But you all know the communities you're in better than we could. So how do we match up those two things together?
I think Rachel's comment is perfect. It's where people are already going, where they feel comfortable, where trust, that's key, because, we don't always have control over what's around us, but we all know who we trust and who we don't trust for that. And so getting that difference, like, are you going because it's just on your way, or are you going because it's where you really do feel good about yourself and you like it? So, okay, great. And how can you incorporate some of those resources that you learned about today into, I'm assuming, practice or everyday life, working with patients, and not just patients too, that multi approach that you were talking about earlier? What about policy? What about everyday conversations with people, funders, grant writing, everything we do? And it's also perfectly fine not to have all the answers right now. I think if we did, we wouldn't be here. And so thinking about these ideas as we move forward as well is great. And I know that I'll be in touch, and we'll be in touch with each other moving forward. So, and we'll be introducing some ways to do that digitally as well as directly in a little bit. So any other support or resources from the AHA that might be useful for us here? Does anybody have any ideas about things that they haven't seen or haven't heard about? It seems like we've covered so much, but there's always great creative people out there with great ideas. Okay, well, I think we've thought about some things. I have to say, just from having the privilege of facilitating, it's such a great variety, and I really respect and admire all the work that everybody is doing. It's really great. So I appreciate that we're connected. I know I'll be getting in touch with people. So there have been ongoing efforts for many years to provide various forms of assistance to people with substance use disorders. And we've created screening instruments, workflows, and medications to help us identify patients in need of treatment and provide them with the care that they need. We've attempted to increase the availability of treatments and added recovery coaches and peer support groups to help guide patients to their care. And despite all these technical changes and improvements, only 1 in 10 people with substance use disorders receive treatment. So one of the primary barriers to improving this treatment rate has to do with stigma that exists around substance use disorders. And many patients who have substance use disorders feel shame and judgment already. And many patients, due to the stigma, it results in doubts about whether they can or even should receive the treatment that they need. There's evidence for it. So a central strategy to addressing the stigma is to become more aware of how we talk and discuss and how we treat people and how this impacts on our feelings and subsequently our actions regarding addressing substance use disorders can hopefully be managed and resolved over time. So to this end, the Superior Health has launched a Shine on Light Stigma campaign, and we're asking that both organizations and individuals sign a pledge to use non-stigmatizing language around substance use disorders. So when we see each other as being more similar than different, or at least respecting the differences and caring about each other through those differences, and seeing how substance use really and substance use disorders really do touch everybody in all of walks of life, whether we see it or recognize it or not. We want to be able to reach out and connect in those ways that are supportive and helpful. So our words matter, and these are the links, and I'll be sharing those as well. I know I shared the link earlier, so I'll just pop that back in the chat here. Okay. Right there. Thank you for your patience. And let's see. So here are 4 simple steps that you can take right now to begin making a difference that will improve someone's chances of receiving appropriate health care for substance use disorder, which is take the pledge, learn about stigma by listening to the stories of people who lived with the experiences and are comfortable and respect if they do not want to talk about it either. And use non-stigmatizing, person-centered language, share the Superior Health Quality Alliance's website and media toolkit with others. Okay, so we also want to invite you, and this is how we stay in touch digitally. It's a really great network called Connect, so Superior Health Connect, a shared learning environment for superior health participants to come together, foster and promote an all teach, all learn climate that provides the framework to improve and sustain mutual health care quality improvement initiatives locally, regionally, and nationally. And so we have the link there. I also believe I shared it, or I can share it again in the chat. And it's really wonderful because we get notifications, and we'll be posting information about not only the webinar today, the slides, and how to stay in touch, but also how to continue working with one another and attending webinars in the future and getting more information on how to integrate into our practices and our healthcare in our everyday lives. So next topics, next webinar is on August 16th of this year, and it's on the importance of immunizations for those with chronic diseases. And when you go to that registration link that I shared earlier, and again, I can share it again, it's to register for all of those sessions. So you just need to register one time. And so they'll have September 20th, how to take a blood pressure. October 18th is going to be about health workers, why do we need them, and how to integrate them into your care flow. We're gonna have a spotlight on diabetes in November, on November 15th. And on December 20th, we're gonna talk about cardiac rehabilitation and what your patient hasn't told you. So I'm looking forward to that. And again, here is registration. And if you need help for signing up for Superior Health Connect or on how to integrate any processes or assistance, please email Jerry and we can set up a one-on-one call. And please reach out to us with questions and to continue this discussion. And thank you, Chenna, for your comment as well. And thank you for attending, and thank you again to our participants and my fellow facilitators. So here's their contact information to contact them about this or how to reach out for additional opportunities.